Hello, everyone. It is that time again for the last session in our series for the year. I'm Joyce Troxler. I'll be facilitating today's session.
Good afternoon. My name is Schuyler, and I'm an assistant clinical professor at ETSU, precepting in the Addiction Medicine Fellowship, and a former fellow of Dr. Troxler's and Dr. Hale's.
Yes, indeed, he was. Thank you very much for being with us today, Schuyler, and continuing to contribute to the work we do here. So I will turn the floor over to you, Schuyler.
Well, the topic I'd like to press with today is adolescent addiction. I have no disclosures. As I said, my wife and I are just cattle ranchers. These are our objectives for today: gain knowledge about the most recent trends in adolescent addiction in the U.S. and to understand how fentanyl supply forms are resulting in increased adolescent overdose deaths. So this is my outline, and I'll start with some definitions. These are the definitions associated with the World Health Organization and the UN. I just bring it up because the age range for adolescents, I think, is a bit of a moving target. World Health Organization defines it as the second decade of life, 10 to 19 years of age. Children are defined as anyone under the age of 18. And then youth, defined by the United Nations as 15 to 24, and young people as 10 to 24. So when you see statistics and you see those terms, you want to be very sure what age you're specifically talking about. So we're here to talk about adolescent addiction, a treatable chronic medical disease involving complex interactions among brain circuits, genetics, epigenetics, the environment, and an individual's life experiences. These individuals end up engaging in both use and behaviors that cause harmful consequences to them. Prevention can be effective, but no more effective than other chronic diseases, and we shouldn't be distressed about that. People who engage in such compulsive behaviors and use long after the experimentation phase are suffering. They live in pain, whether it's psychic pain, physical pain, emotional pain, and no one loves pain. So I want to begin with the NSDUH. This is the latest is 2020, and this will have some relevance for our fellows as this will be the data that they'll be referencing on our boards this fall. So the caveats are that in spite of the fact that DSM-5 has been around for many years, 2020 was the first year they used DSM-5 diagnostic criteria versus DSM-4 for their statistics. Additionally, there were some changes in the questionnaire itself. So there are some caveats on comparing to the past. So substance use among people aged 12 and older, big picture, overall substance use, not abuse, use. 162.5 million people used a substance in the United States last year, over half. Tobacco, alcohol, or illicit drug. 50% drank alcohol, almost 19% used a tobacco product, and 13.5% used an illicit drug. Use disorders among people aged 12 and older in 2020, 40.3 million people, or 14.5% of our population, had a DSM-5 criteria substance use disorder in the past year in 2020. 28.3 had an alcohol use disorder, 18.4 million an illicit drug disorder, and 6.5 million had both. Now, if we drop down into the data, the percentage of people with alcohol use disorder was highest among, as no surprise, among young adults, 18 to 25, followed by over 26 adults. Adolescents aged 12 to 17, 2.8% or 712,000 people are estimated to have an alcohol use disorder. Estimates of binge alcohol use and heavy alcohol use in the past month among underage people. Here's another age discrepancy. This is under 21, not covered in any of the other percentages. That was 9.2% or 3.5 million for binge and 1.8% or 670,000 people with heavy alcohol use. Current binge alcohol use, adolescents aged 12 to 14, 4.1% or 1 million people currently have binge alcohol in 2020, the last NSDUH statistics. Current tobacco product or nicotine vaping, nearly 2/3 of adolescents who use nicotine products are current, as is the last month, vape nicotine, 63.1%. Adults over 26, essentially 90% of them use only tobacco products. But in 2020, adolescents 12 to 17 used an e-cigarette or a vaping device to vape nicotine in the last month, 1.3 million. Illicit drug use. Marijuana is the most commonly used illicit drug, not the most commonly used drug. Alcohol is the most commonly used drug. 17.9% of people aged 12 and older, or almost 50 million people, were using it in the past year. Percentage was highest among the 18 to 25 young adults, and then over 26 adults. Adolescents aged 12 to 17, 10.1% or 2.5 million are currently using an illicit drug. 3.3% misuse prescription pain relievers 12 and older. Among adolescents, that was 1.6% of them, or about 400,000. And that, let me go back. These prescription pain relievers is something that is identifiable by a shape and color of a pill. And that'll be important as we go on in this talk. Among those 12 and older, 2.6% of people were using hallucinogens, about 7 million people. Adolescents was percentage of young adults, 7.3% or 2.4 million, was higher than the percentage among adolescents, who were only 1.5% or 370,000. However, hallucinogens remain a significant problem in our young population. And then for those using cocaine, 12 and older in 2020, 5.2 million people. The percentage of cocaine use was lowest among adolescents, less than 0.1%, 2,000 people. Initiation of substance use. Let's go with the number one used substance, alcohol. 1.8 million adolescents aged 12 to 17 initiated alcohol use. For those who initiated cigarette smoking, most of them did so before age 25. Those who do not use alcohol by age 25 are much lower likelihood of ever becoming a user of alcohol. The same is true for cigarette smoking. Marijuana. 2.8 million people initiated marijuana use in the last year. Again, just as with cigarette smoking and alcohol use, most people started using marijuana before they became adults, age 26. 1 million adolescents aged 12 to 17 initiated marijuana use in the last year on this 2020 study. Cigarette smoking, good news is that cigarette smoking is down. 385,000 adolescents aged 12 to 17 initiated cigarette smoking in this in the 2020 study. So among people who used 12 to 18 in 2020, among people aged 12 and older in 2020, 2.5 million used meth. Adolescents aged 12 to 17 had the lowest estimate of past year methamphetamine use, 0.1% or 21,000 people. And as you saw back, crack cocaine was even smaller. Initiations of substance use, prescription pain reliever misuse. Unlike initiates of cigarette, alcohol, marijuana use, 2/3 of the past year initiates tried prescription pain relievers for the first time as adults after age 25. So let's move to another study. And this is 2021 data. This is exceptionally good news. Monitoring the future study has been going on since 1975. It initially just interviewed 12th graders, has been interviewing 8th and 10th graders since 1991, and they have monitored emerging substance use problems and tracking substance use trends since that 1975 initiation. There has been a broad and deep decline in drug use in 2021 among 8th, 10th, and 12th graders. This is the proportion of students who say that they used any illicit drug in their lifetime or in the last 12 months has dropped sharply across all grades combined. The amount of relative declines from the prevalence level of 2020 was 22% in 2020 and 27% in just that 1 year. P level, the significance less than 0.001. These are the largest and broadest declines seen in this study over its 46-year history. And this is the schematic. As you can see, the red is 12th grade, the blue is 10th grade, and the green is 8th grade. From 2020 to 2021, everyone use of any illicit drug in their lifetime decreased. Use of any illicit drug other than marijuana in their lifetime all decreased significantly. Any illicit drug in the last 12 months and any illicit drug other than marijuana in the last 12 months. These are pretty staggering numbers. Alcohol use also declined. The proportions of 8th, 10th, and 12th graders who reported drinking in the 30-day period prior, so current drinkers, 7% of 8th graders, 13% of 10th graders, 26% of 12th graders. And it would appear that COVID-19 had a substantial effect. as some of you may be agog, for 10 plus drinks, the effects of the epidemic in 2021 showed, as all three grades showed significant declines, 0% in 8th graders, 2.1% of 10th graders, 10 plus drinks at a single sitting, and 3.2% of 12th graders. 15 plus drinks only asked of 12th graders, 1.3% of 12th graders. So those are staggering amounts of alcohol and would indicate a significant tolerance. So these are the trends in binge drinking. In general, excellent, really outstanding drops in all of those from 20 to 2021, from use to perceived to the availability, because all of these are obviously underage. The concern about this is that what also dropped is the percent disapproving of having 5 drinks in a row once or twice each weekend. From 12th graders in 2020, who were about 75% disapproving, now only about 59% are disapproving. And the same is risk of having 5 or more drinks. This drop in 12th graders' concern about risk is likely to be a trend line and needs to be watched. Marijuana shows a sharp decline as well. Declines from 2020 amount to relative declines from the previous year, 24% in 8th graders, 27% in 10th graders, 25% declines in 12th graders. And these one-year declines all are significant at the point or less than 0.01. I think someone let the dogs in. I'm sorry. It is a farm. So the use of marijuana also showed significant declines, but also has been on a trend line of the percent of using regularly disapproving of that is decreasing in 12th graders, decreasing in 8th graders, went up a little bit in 10th graders. Availability, supply chain affected everyone during COVID. And those seeing great risk in using regularly, we have seen a consistent downtrend since 2000 and well, actually peaked in the 1990s. There has been a continual downtrend in those seeing significant risk in using regularly, and of course this fuels our future use. Vaping declined in 2021. The annual prevalence for the 3 grades combined dropped 7.9 percentage points, reaching 19% annual prevalence. Definitely significance from a 29% the previous year, highly significant. And vaping has only been followed recently, and that looked like that peaked in 2019 and has been going down since, which is good news. Now, what's the bad? It shows you the good. Some drugs held steady. Inhalants, hallucinogens other than LSD, crack cocaine, heroin, OxyContin, and Vicodin, Ritalin, and dissolvable tobacco products. So here's heroin, and those who used in the last 12 months, certainly there's a continual decline. Disapproval is high in general, little drop in from 20 to 21 in all grades. Great risk, 8th graders about the same. Look like 12th graders showed increased risk, and 8th graders showed decreasing risk. 12th graders showed increasing, and 10th graders stayed about the same. And all of them found it pretty difficult to find. But then looking at narcotics other than heroin, OxyContin, Vicodin specifically are named in the survey. Use of narcotics has in 12th grade, this was only asked in 12th graders, has been on a significant decline since the time when prescription drug monitoring and tightening of the supply from physicians that had been running some high number pain clinics. That has all declined with the use. Vicodin down, the availability significantly down, and then the use of OxyContin down. One of the problems about the MTF study is they did not ask a disapproval or risk question about using narcotics other than heroin. Psychotherapeutic drugs outside of medical supervision remain a problem. Young people in general seem less concerned about the dangers of using these drugs because they're legitimately used by adults that they see. Silver lining is that the use of narcotics other than heroin has shown that continued decline since 2009, as I showed you on the previous slide. Much work yet to be done. You can't treat what you can't identify, and routine screening would appear to benefit the introduction of early interventions. However, the U.S. Preventive Services Task Force continues to state that screening for substance use in adolescents is not recommended. In their defense, you do need to have evidence-based effective interventions to make screening useful, and long-term studies are frankly not available. So the work that needs to be done are some of these studies. McCabe, the reference is at the end of my talk. McCabe studied 11 cohorts in the MTF, the Monitoring the Future study of 18-year-olds. And he studied them in cohorts from 76 to 86 and followed them to age 50. Most of these individuals who had severe substance use disorder when they were surveyed in 12th grade still had 2 or more substance use disorders symptoms in midlife. And those with the highest severity substance use disorder in adolescence also had the highest likelihood of prescription drug misuse decades later. The majority of adults that were using prescribed opiate sedatives or tranquilizers, looking back, if they had participated in this cohort study, they had multiple substance use disorder symptoms when they were originally surveyed in their teens. The American Academy of Peds has recommendations regarding the use of resources for medication-assisted treatment within primary care and access to developmentally appropriate substance use disorder counseling in communities. Pediatricians have an AAP endorsed buprenorphine waiver course and recommends that pediatricians consider either offering medication-assisted treatments to their adolescents and young adult patients with severe opiate use disorders or refer. So what's the ugly? $107,000 deaths, December 20 to December 2021. Most of that was opiates, and most of that was fentanyl. 518 deaths among adolescents in 2010. Rates stayed stable through 2019 with 492 deaths, so 2.4 and 2.36 per 100,000 from 2010 to 2010 to 2019. Death increased to 4.57 per 100,000 in 2020 and to 5.49 per 100,000 in 2021. Overdose mortality increased by 94% from 2020 to 2021. The overdose mortality is now standing at 20% of overdoses are fatal. Among adolescents, fentanyl-involved fatalities increased from 1.21 per 100,000 in 2019 to 3.26 per 100,000 in 2020 and to 4.23 per 100,000 in 2021. Fentanyl was identified in 77% of adolescent overdose deaths, compared to 13% for benzos, 10% for meth, 7% for coke, 6% for prescription opioids, and 2% for heroin. Highest risk are American Indian and Alaskan Native adolescents. These are the trends in overdose deaths. That line is illicit fentanyls and their synthetics. And this is the racial ethnic breakout. American Indians and Alaskan Natives. This is Latinx, this is Caucasian, and this is Black or Afro-American, non-Hispanic. So why is this happening when all of the use seems to be going down? All of the availability is going down. In the past, fentanyl has come into the country in powder form. Over a quarter of fentanyl seizures are now in pill form. And those pills are pressed pills that look exactly like Percocet and Lortabs and Vicodin and Xanax. The stories of first-time use at parties of what they think is a Percocet turns out to be an analog of fentanyl, and they're dead before their friends even know they've stopped breathing. So what are the takeaways? I think we need to screen adolescents for substance use and offer treatment with evidence-based therapies. This is a recommendation of the organization I belong to, the American Academy of Pediatrics. We need to deploy life-saving interventions to adolescents. Some of you may have heard that term referred to as harm reduction. As harm reduction seems to be getting a bad rap, particularly locally, I've changed my language, because language is important, to life-saving interventions, evidence-based life-saving interventions, with getting naloxone out into our adolescent population and at places where adolescents gather. And we've got to do a better job on talking about counterfeit pill education. And those long-term studies for treatments and therapies need to be begun now. These are my references. And that's all I have.
Thank you, Schuyler. That was both encouraging and discouraging.
The good, the bad, and the ugly.
Hanged it well. Questions from anyone? So I do have a question, because I want to make sure I'm understanding it correctly. Can you go back to some of those slides that have the 4 up, the graphs?
Which one would you like?
Towards the beginning, where it's kind of like that part of like risk and
risk. Alcohol, or do you want opiates?
So disapproval and risk. So just so that I'm understanding that correct, because everything is like it's going down. But I'm
Yes.
looking at so is disapproval like I'm not as disapproving and I don't see it as risky? Is that
Right?
what
Correct. They do not see it as risky.
Okay.
The percent disapproving was 75% of having 5 drinks in a row once or twice each weekend. You know, Saturday and Sunday, that's 5 drinks. I'm 16 years old. I should be able to have those 5 drinks. The crazy thing is some of them are having 10 and 15 drinks.
Yeah. But what's interesting is it's kind of foreshadowing. I think you said this.
It is.
Disapproval and risk numbers is going down. We're going to see the use go up. And now that we're not in lockdown, we're going to see a change with our availability.
Right. And the caveat, of course, is that there has to be some understanding that that the risk of use is actually the more important statistic, because availability and the lack of social engagements where they would normally drink is has been decreased over COVID in 2020 and 2021. Once that lid comes off and everybody's out there and the parties are going full bore on the weekends, that risk is what's going to drive it. And we know that 18 to 26 is the highest rate of binge drinking and heavy alcohol use for any population, and these 12th graders are going right into that because they don't see as great a risk and they don't see that much disapproval. As soon as the availability goes back up, boom, waiting by the door.
Okay. Well, just makes me feel like we need to be working a whole lot more with our adolescent population, and quite honestly, pre-adolescent as well.
Yeah, because 8th graders, you can see where 8th graders are. So which means you've got to start at 11. You've got to start at 10, 11.
3, 4, 1. That's also part of engaging families, though. The environments these children are in. I know whenever we do our intakes and we talk a lot with our family, with our patients, at what age do you remember? Like, what is the first time you remember thinking like that's a drug? I've been exposed to someone around me using a substance, and it is pretty much, I'd say 5, 6 years old. Like when they first have formed, like really, like I remember that age. So it's been around them since before they had memories, quite honestly.
But with our overdose deaths increasing so much, I think back of our drug timelines that we do on the patients when they have their initial intakes in clinic. What was your first exposure to an opiate? Oh, I had a Lortab.
Yeah.
Or I had a Percocet. Well, now those aren't Lortabs or Percocet, they're fentanyl, and they're naive.
Yeah.
And so even though the use is down, the risk of death is incredibly high.
Yeah. There is a dichotomy there.